Good morning, everybody. I can see everybody started joining. Salvaya joined. Priyatadi also joined. We are waiting for Tasbir sir, but hopefully he will join too. And thank you so much, Saida. I heard from Salvaya, you just finished your night and you joined.
Yeah, hi, Pujapu. No problem.
It shows seeing that.
Just little sleepy.
Okay, understandable. Are you going back for the night today or?
No, no, I'm off, so
Okay,
it's good.
okay, okay. Okay, so we'll wait for a few more minutes, then we can get started. All right. So it seems like it's almost 8 minutes. We did wait. We will get started so that we can keep ourselves in time. And I also saw that Tasbih sir joined. So we will start with Tasbih sir if everybody's agreeable with that, so that we can ask all our questions to the attending who had been in this field, helping us mentoring for residency and also for fellowship. I think that will be great. Tasbih sir, if you please can come forward and talk to us.
আমরা কি শুরু করে দেব? Should we start now?
Yes, I think so. We can start.
Okay, do you want to introduce all the panel members or all?
Yeah, sure. Let's do that first. So I will first mention about Sahil Bhaiya. Everybody knows him by this time. I know that. So he had been helping all the applicants who were from Bangladesh or around US trying to get into residency and fellowship and had been guiding us, and also for the research publications and getting into the research fellowship or trainee positionship. Currently, and he did finish his residency. I will give the floor to Salvaya so that he can introduce himself.
Thank you so much, Pooja. I really appreciate you guys. I know that today Tajibai has been very busy. Salima is just back from the night. Utsho also might have some responsibility. And Prince, he was pulled for ICU rotation. So everyone has been very busy, and I really appreciate everyone joining this session. I don't want to say much about me. Seems like most of the people are here know me. So I would let you guys talk about the session.
Thank you so much. Then I will go to Priyatadi as well. Happy to see you after some long time. Currently, after finishing internal medicine residency, you are working as an attending. I will give the floor to you, and you had been working tremendously in the research works and being a moderator and mentor. So the floor is all yours.
Thank you so much, Pooja. Hey everyone, good morning. I'm Priyata. I am currently working as an attending physician at Presbyterian Hospital, Albuquerque, New Mexico. And I finished my internal medicine residency last year in June from St. Joseph Mercy, Ann Arbor, Michigan. And congratulations to everyone for getting matched into your desired specialties. We are really happy for you. And thanks for joining this webinar. I hope you will find this webinar helpful. Thanks.
All right, thank you. Then I will introduce Utsho, currently in residency, if I'm not wrong, or maybe you graduated already. All right, the floor is to you, Utsho.
Yeah, thank you, Didi, and happy Sunday, everyone. It's good to see all my mentors and everyone in the same platform. It's always a privilege. So happy Sunday, everyone. My name is Utshu. I'm a PGY3 chief resident currently at Mount Sinai Queen's Hospital and going to be an incoming fellow at Cleveland Clinic for Geriatrics Medicine.
Perfect, thank you. Then I believe Prince didn't join because he was pulled to do ICU. So I will introduce Saida. If you can introduce yourself and talk a little bit about you.
Sure. Good morning, everyone. I'm Saida Salima. I'm a PGY2 from South Brooklyn Hospital, before it known as Coney Island Hospital. Good to see you all. I was a mentee before, and it's an honor to be here. Yeah. Thank you.
Okay. And then I think you all know me too. I had been working with PHA for a long time, and we had been trying to help the residency applicants and also who are interested in research so that we can at least give some guidance when you are going through this arduous path. And Tasbir sir actually created this platform for all of us so that we can reach out to you all. So I will give the floor to Dr. Tasbir sir so that he can talk and guide us.
Thank you, Pooja. Let me see. I can share the PowerPoint. 1 second. Host has to permit me to share my PowerPoint. Pooja, can you do this?
I think you are the host now. You
Yeah.
can be here.
Okay.
Try one more time. I think you'll be able to.
Okay. Yep, I got it now. Can you see my slide?
Yes.
All right. First of all, I want to thank everyone, especially Sahil and his team, like Pooja, Prince, Priyata. I know Priyata very well. So Salima and everyone. So I know you're taking so much time, to guide the incoming resident or incoming those who are interested in taking the USMLE. I still remember my days when I was preparing myself for the USMLE back in 2000. Nobody was there to guide me. So I have no idea what I'm doing. I have no idea what I have to read. I have no idea how the residency run, what I have to do in the residency, what's the expectation. So basically, I was no idea. only positive that I was working in the United Kingdom, so I know a little bit of the Western world. That's it, basically. So I think kudos to you guys because this is a huge you're doing, to help the Bangladeshi students. I think hopefully everybody will appreciate that. So I'm going to talk about, what do you really need in an ideal resident? I can easily say my title as How to Survive the Residency. It's not the survival because you have to excel. You have to stand out. You have to be the number one, best of the best when you finish your residency. So it's just not like survive, just finish, and then done. Not that should be that attitude. Your attitude should be the stand out as the one of the best resident. So you want to be the 5-star resident when you finish your residency. So first, I don't have any disclosure. So vision, the vision without action is a dream. Action without a vision is a nightmare. So you always should have a vision and action both. So you cannot just dream it and no vision, no action. So you have to work on it. And if you can dream it, you can achieve it. So that is the mool, we call it mantra, so, and that should be your attitude. If I will give you the data published in 2019, that is the survey. They found actually our job is dealing with the general population. Our dealing is to help people, to make them better. And you can see their perception, only 2/3 they're happy with the med school or hospital. Majority, almost 1/3 not happy with the med school or the hospital service. And you can see the major problems the patient has against the doctor is they don't treat them as a whole. They just treat their medical conditions only. That should not be the attitude. Your attitude is to see them, to treat them as a whole and treat them as a part of your family. That kind of mentality you should have. That is, he's your or she's your part of your family. And also the other complaint is they then they don't look at us, they don't listen to us, they don't spend much time, they always feel like they're in hurry. So we should not be. Also, there is some question raised about the medical knowledge as well. That is a perception because of we are in AI juke, we are in chat GPT, everybody knows what's going on. So it's always keep you updated with the medical advance, So that is very important. Give time to the patient, listen to them, and also keep you up to date with the latest development in medicine. So first, what you have to do is learn your surroundings. So important. Sometimes when you start your residency, you have no idea what you're doing. Meaning, what's the expectation from the faculty? What is the expectation that, your program director or the other faculty or the senior resident wants from you? So get inside information, how the round runs, how the MDR, the multidisciplinary round, they do. How do I present? Every attending has their difference. Such as me, I don't want 2-page presentation. I want very concise presentation during the round because in the round there's a lot of people around, like the nurse, like pharmacy, in ICU. I'm talking about the ICU, then the dietitian, caseworker. So everybody has their own work. They don't want to spend 3-4 hours in the round. So you have to be very concise. But to the point, like bullet presentation when you do the presentation during the round. But many maybe want more details. We should know how their rounding style. They want detail or concise presentation. Also, you need to know that, the building layout. You need to know what is the 8th floor means. Is a neuro floor or is a surgical floor? What is the ICU? Where is the step down? Where is the ER? Where is the that labs or other imaging department, because it's very important to know the layout, because you have to go on and off when there is a rapid response or there is a code blue. So it's very important to familiarize yourself. Before you should go and see the building and the floor plan before you start the residency. And also figure out where's all the departments. Make a great first impression. That is so important. If you start, if you stumble when you start, it's very difficult to recover yourself. You have to be very, thorough. Number one. Number two is be there all the time, be courteous, dress and present professionally. Another thing I must say, especially in our culture, Indian, our in subcontinent, then we use a lot of spices, and sometimes there is a smell in the especially when you wear a white coat or the jacket. So it's very important make sure it don't smell, and it is reportable. They can report to higher authority that he or she smells. So it's very important that be careful of those things. It's very small but very important. So dress and present professionally, pay attention during round, don't be on the phone. Such as sometimes when rounding, the attending asking some question, our response is look at the online quick what he's talking about. Don't do this. If you don't know, that's fine. But looking at the phone is very uncourteous and unprofessional. Be involved in your patient's care. Always have a great attitude. Actively engage and connect with everyone. Be punctual. Don't be late. If you're late, you're doing something else around standard, message to your senior resident, listen, I'm a little late, but I'm taking care of one of the patient, not doing great. But always, be punctual. We talk sometimes too much, it's important thing, be a good listener. Listen first, before you act on it. And put your phone away. It's very important during the round or when you're talking to somebody, make sure you're not on the phone. So it's very, very important, and make a great first impression. If you do mistakes later, everybody will forgive you. But if you start bad, you're not in good book. I have one resident now. Unfortunately, she is not in good book. She's a great resident. She is doing great. She is very knowledgeable. Procedure-wise, she's one of the best. But unfortunately, she wasn't in good book to start with because she was a little argumentative. And that actually now she's paralyzed and she's working really hard to make an impression. So it's very important to make a good first impression. Anticipate the needs. So meaning that you have to be proactive. It cannot be reactive. So proactive, like, pre-round, see the patient before starting the round. Look at all the data. If someone if you come in and saw the lactate was high, just put the orders for the lactate before you starting the round. Like if you see the patient is febrile, patient is white cell is going up, blood culture was not ordered, do the blood cultures. That kind of thing you should do proactively. Anticipate the procedure. If you need, patient has multiple pressors, doesn't have a central line yet or something, so you talk about it. So patient need a line probably. So if the patient is not doing great, patient is only on BiPAP with high setting, you anticipate and tell, okay, probably patient need to be intubated. You alert the team that the patient is not doing great, rather than waiting for the round, talking the round. That is, it shouldn't wait for this. If you anticipate something, we need to do it now. Recognize the acute needs and leverage the nursing. That is so important. Involve the nursing. Me, when I do the round, before actually what I do, first thing I do before the round, I talk to the nurses. But they know so much about the patient. They are with the patient all the time. They know the family dynamics. So I talk to the nurse even before the round to get the more detail about the patient so that I can talk more sense when I do the rounds. So especially, it's not the nursing, it's the nursing aid, nurse therapist, and all of them. never stop learning and be curious. Okay, it's so important because sometimes you feel like, oh, I'm the resident now, probably I need to need to study less. Okay, when you'll be a consultant, probably you need to read less. No, always be curious. Always remain a teacher and share your knowledge. You cannot believe how much I learned from the student. We have medical students from the Chicago Medical School. How much I learned from the resident and nurses every day, even from the dietitian, even from the what they call that one, the pharmacy. Like before many years ago, I thought statin has to be given at night for better work because that is the way we are taught that statin should be given at night. But now that is only for the simvastatin. Like for atorvastatin, rosuvastatin, actually you can give any time of the day. So that I don't know until few years ago. Like that you can use baclofen for the hiccup. I didn't know until the dietitian told me you can use baclofen for the hiccup. So so you can learn so much. There's another, like, somebody on multiple pressors, we try not to give anything, we don't do tube feeding because it can cause NOBN, the non-obstructive bowel necrosis. I didn't know until a few years ago when the dietitian told me that Dr. Islam patient is on multiple pressors, better not to start tube feed because of the NOBN. So it's very important, to talk to them and you learn so much from everybody. Aim for humility over arrogance is so important. Be humble. It's good to be confident, but but don't be arrogant. It's a fine line. So it's very important. You're human. You are there to help people. So sympathy is not good enough. Okay. If somebody can actually take care of the admitting, because nobody's taking, I'm actually inviting everybody. If somebody is waiting for the room or something to join, please make sure you admit those candidates. So anyway, so you have to be, sympathy is not good enough. You have to be more than sympathy, like empathetic or compassionate. You need to be more engaged with the patient. So be empathetic and compassionate. So to remember, the patient is not just a list of medical problems and medication, they're human. So spend more time and be with them. Cultivate a great bedside manner. That's we don't do sometimes. Sometimes we're in a rush. Sometimes we're standing even to and talk to the patient. Don't show that you're in a hurry, you're in a rush. I have a lot of things to do. Like, just tell me in 5 minutes. No, take your time. The patient has a lot of things to say to you. They're in despair to share their problems with you. So, and they're here to get help from you. So it's very important you give time and don't show that you're in a rush. Be empathetic and give time to listen to the patient and then decide what to do. It's not what you say, it's how you say it. It's very important. Sometimes, because of the miscommunication, so many blunders can happen. So it's very important, communication, not only the patient, with the family, with the nursing staff, with your colleagues, with the attending, with the nurse, respiratory therapist, pharmacy, everybody. So good communication is very important. And always solicit feedback from the patient. So to make sure you're doing a good job, patient understand what's your plan, patient understand, doesn't have any, what's going on and what's going to happen. So what's going on today? What's the plan? What's the diagnosis? What test is going to be happen? So always make sure they understand. So always take the feedback and always ask at the end, is there any questions they have for you? So being a good listener is critical to being a good doctor. It's very important. So listen, listen, listen before you jump into conclusion and say something to the patient. So always you clarify, you introduce yourself, then pay attention, then withhold any judgment, don't, and be respectful to patient's culture, religion, and so on. Then when you listen to the patient, then you talk back and summarize what we talked about. Then you share your thought with the patient and then reflect on it. So it's very important. Take your time. And that will make you a good listener. And that is so important to become a good doctor. We talk about a lot of patient-centered care these days, because patient is right in the center, and patient is the boss, and you're not the boss. The patient is the boss, our family is the boss. You just do whatever patient wants. Nowadays, we don't impose our decisions on the patient. We don't. What we do, we listen to the patient, then we look at all the data, then we give some advice. That is number one, number two, number three. And the way I put it down to the patient, so this is the choices you have. And if it is my brother, my dad, I will do number one first, then, but it's up to you now what to decide. The family, most of the time, they will listen to you and they'll go by with you. But some of them, they say, I don't want number one option. I'll go for number two. Be respectful. If you have some reservation, if you think the patient is not making a right choice, you try to convince the patient in the right way, but eventually it has to come from the patient. So patient-centered care. You know that, we maybe, we have a lot of medical knowledge. We are, did a lot of studies. We have, degrees, we passed the USMLE. So totally agree. Medical knowledge-wise, we are much enriched than the patient, but they know their body. So they're the boss. They know their body better than anybody. So it's very important, be respectful. So paradigm shift is the way you used to do. This is the typical, the medical evaluation, go by the chief complaint, history of illness, past medical history, family history, and so on. That is the very, traditional way to take the history and communicate with the patient. But remember that one size fits all, that's not the concept anymore now. You cannot just put the barcode and scan and say, okay, that's the same thing for everybody. It's more phenotype-based approach, or, what's their clinical expression. So it's very important. That part is gone. Actually, more personalized health planning, meaning engaging the patient, look at the current status and health status, listen to the patient, desire and patient's goals. Then you put your goals, then come up with the plan what's the best for the patient. So it's very important coordination of the care and listen to other members of the team, such as nurse, such as the pharmacy. Listen to everybody, then come up with the plan what's the best care you can provide to the patient. So in our time, when I was in med school, even in Bangladesh now, actually, when you start rounding, you close the door. You take all the families out of the room and do the round inside. No idea what's going on. Still, that is the same going on in Bangladesh. But now what we do, we actually invite them in the round. That especially in ICU now, they're actually doing the same concept, trying to put it in the ward as well, in the float as well. That is, you invite the patient, invite the family in the round, such as me. When I do the round, actually, I invite the family in the round, where there is a pharmacy, respiratory therapist, dietitian, resident is presenting, then also the caseworker, physical therapist, everybody is there, the family is there. If I see the patient is not intubated, patient is not confused, patient is not in isolation, I go inside the room and then involve the patient in the rounds. They should be treated, the family and the patient, the part of the team. They should listen. And that is the trial we participated when I was in Indiana University and Lafayette campus back in 2013, that A, B, C, D, E, F bundle. F is for family. So that bundle actually, initially we thought, oh my God, that will be a disaster, involve the family or the patient in the round. The round will go long like forever. But actually, it's not the case because family really appreciate, the patient really appreciate that, that so many people taking care of their loved one. And eventually, you don't need to go back again. They know exactly what's the plan, and they know exactly what's the procedure or whatever need to be done today. So it's very rarely to go back again. So, and the nurses are very happy. They don't have many, the family doesn't have many questions for the nurses as well. So it's very important, involve the family and the patient when you do the round. You invite them now. So no closed door rounding anymore. Availability and accessibility, that is so important for everyone. So basically, it should be available and it should be easily accessible, like, answering page, answering, when they call you, be there quickly. You always proactively, if you see some labs and it's abnormal, you go to the patient and brief them. And this is, we found it now, and that is, we'll do it now. Such as if you found something, troponin is going up, and you said, I'm going to look like you have a heart attack. We're going to talk about the cardiology and maybe do the echo. So proactive kind of thing. And always available. If the family comes late, probably not in the round, came late, and then they're looking for the doctor, make sure you go and talk to the family quickly. So always available, not for the family only or the patients only, also for the attending, for the senior resident, for the nurses. Nurses will call you all the time for any concern. Make sure you're available and be nice with them. It's very important. Otherwise, they can make your life miserable if you're not nice with them. If you're really nice with them, they make your life really nice, So actually, they can, the nursing staff, not the nursing, anybody, even the respiratory therapy pharmacists can go to the program director and tell against you. Or they can write an email complaining against you. So be careful, So it's very important you're available all the time. Ability to work as a team player is so important. You're actually part of the team. You're not alone. You're not the only member in the team. There's a lot of the members in the team, so you have to play with the team as a team player. Such as it's a collective decision. It's not like what you think. What we think as a team for the best care to the patient, that you act on it, not like what you think. So it's very important that you work as a team player. Collaboration is so important. Strong work ethic, meaning that work harder every day. What you did yesterday, you work more tomorrow, and get your hand dirty. And be available. If you stay a little bit extra hours, like, we did very late putting a central line. He did the central line late. Let's tell my resident, don't go home without looking at the chest x-ray. If you have to stay extra 5 minutes, stay 5 minutes, look at the x-ray before you go home. So it's very important. Don't leave anything unless it's too late, that is different. But otherwise, 5, 10, 15 minutes here and there, please stay, finish your work. And so don't leave anything for others. It's very good. They'll be, because when you're giving sign up to the night team, say you're working a day, they'll be busy as well. Why should they carry your job, what is undone in your shifts? Let's try to be, very vigilant. Number one, work hard, do your job. And that actually requires strong work ethic. Time management skills is so important. So because such as the most of the attending really get annoyed when they got their progress note from the resident and they're at the end of the day. Such as we did the round at 9 o'clock, they're sending their progress note at 5 in the afternoon. That is terrible. Attending doesn't want to wait that long. So me, what I do, I always write my own notes. And then I just co-sign the resident note because some of the residents send the notes so late, I'm done already. So I come and write the notes myself always because, but those who are sending early, at least I can see their notes, and some of the notes probably I missed it and resident picked up. It helps us. So it's very important, set priorities. Make sure you're calm, write the notes. That first thing, I have to write the notes quick and send it to the attending so that they can finish their notes. Get organized, using a planning tool, schedule appropriately, and stop procrastinating. That's very important. So, important thing, time management. Not like if I say something, okay, get ready for the central line, and you actually did it 2 hours later, attending won't be happy. So do it quick, such as you do the POCUS, get the machine and do the POCUS. So time management is so important. You have to know which is priority. Like, procedure is a priority or writing notes. So in that case, you can delay writing notes and get the procedure done because the patient needs a central line. So it's very important, the time management and the priority. So if Golda Meir, she is one of the, she is Prime Minister of Israel, former Prime Minister. What she said. So you actually should have 100% control over your schedule. Residency, not residency, when you become a doctor like me, I'm 59 years old now. So still, I have to, it's not like I'm seasoned. Still, when I go to work, there's a lot of pressure from all directions, like from the patient, from the nurses, from the, family, from administrator, so from the colleagues, then you have sick patient, you have a lot of procedure today, whatever, it's a lot of, it's a lot of work. And so it's very stressful. So you have to know how to work under pressure. So sometimes, you take a break, go down, have some coffee, go down. Some of the physician's lounge has a dark room. So we use the dark room, close our eyes, take a break a little bit, 10, 15 minutes, regroup myself and go back to the work again. And sometimes, sometimes we don't know how to delegate. It's very important to delegate work. Sometimes you cannot do 10 things at a time. So, it's multitasking actually is not a good thing. And, it drain your energy and it drain your thinking capability. So multitasking is not actually, before we used to say, oh, it's a good thing, multitasking, but it's not actually a good thing. So remember that whenever you feel like, it's not safe enough to practice ourselves, so in that case, you ask for the help. So I need help now. So there's a lot of talk going on, multitasking versus task switching. That means you do one at a time, but you switch your task. That is better than the multitasking. You do multiple things in one go, so rather than this task switching. But at the end of the day, sometimes you have to take as, done is better than perfect. Sometimes, you want to be perfect. Sometimes, as long as done is okay, acceptable, just take it, And that's sometimes you have to adopt that mindset as well. Positive attitude and professionalism is so important. Sometimes, I used to, the first thing when you're taking the sign out, say, and the resident is telling you that, there's 3 patients, you have to do the, the HNP. He said, oh my God, I just taking over the service and there's 3 patients waiting for me to the HNP. And I use, oh my God, don't show that attitude. What you have to do, you have to do. That means just then so okay, that's fine, no problems, and I'll take care, go home and take rest. I'll see you tomorrow, rather than, oh my God, I have three patients leave it for me. The resident didn't leave it for you for purpose, it's happened. Maybe he got the admission so late that he couldn't finish. So always say, that's fine, I'll take care of it. Always say, don't worry, go home, take rest. It's always a positive attitude. Though inside you're burning, that's fine. Sometimes you can burn yourself inside, but don't show it. Be positive and be professional. Never lose your temper. So it's very important. So be very careful of those things. That is so important. That is, we sometimes we think we got the residency, then we are done for the rest of our life. It's not. Every steps you need a mentor, and you have to find the right mentor who can really guide you, who can really take you to the next level. So and even in residency, even can be your senior resident, can be your mentor. Your attending can be a mentor. So find the right mentor from day one. So who can actually help you, who can guide you. So explore your network. Even it could be outside of the faculty. It could be outside somewhere else, maybe another resident from another hospital. So explore your network, reach out to them. You need to nurture the relationship. It's not like I met some, the relationship built up now. I got my job done, then I forget about the mentor. No, don't do it. Whoever is with you in your career, always stay in touch with them. That is your job, to stay in touch, and also nurture your relationship. Such as someone who helped you when you're at school. Sometimes send a text and call them. Hey, how are you? How is it doing? Though probably don't need much help from him now, but he guided you or she guided you when you're in med school. Or when you got your residency, I'm pretty sure somebody guided you at that time. Keep in touch. Probably, you never know, they may help you again. So, and express gratitude. That is, we forget all the time. We don't express gratitude. We don't nurture our relationship. It's so important. And that will stay until you die. So it's very important, keep that relationship and nurture the relationship and express gratitude. Sometimes call them, sometimes text them, sometimes, meet up. So last couple of slides, that is so important, the work-life balance. Avoid burnout. So because if you burned out, you'll be inefficient, you'll be less productive, and that's not good for your career. So that's the term was coined by Herbert Rodenberg in 1970, and the book he actually published called The High Cost of High Achievement. So so it's very important that you don't get burned out. So you have to take care of yourself. And that is a sign of the burnout, and look at that. If you're irritable, if you have physical symptoms, you have, depressed, you're feeling tired, you're drained, you're not, concentrating or focused, that will eventually affect your career, eventually affect patient's care. You may not make a right decision. If you're irritable, probably you're not nice to other people. So that will affect your career, that will affect the patient's care, and so on. So it's very important that you don't get burnout. So that is a shadow. The resilience is a shadow of the burnout. So that means it is the process of adapting how to face the adversity, trauma, and tragedy, threats. And it could be emotional resilience, could be mental, could be physical, but it's very important that you have to be resilient. And that's the way you have to. Sometimes you should have high self-esteem. You're very flexible. You make a relation with others who may help you when you're burning out, spiritual freedom and so on. So basically, there's a lot of strategy you can use to become resilient. So Eileen McDurk, she is actually motivational speaker on burnout and resilience. She said, resilience is not about bouncing back. It's about growing through. So it's very important. Take it and just go through rather than, bouncing back. So So it's very important. You have to be resilient. The last slide, you always have a willingness to go the extra mile. Always. It just from ordinary to extraordinary. So always, do go extra miles. So if somebody needs help, okay, I'll do it. If it's somebody, some other attending, such as one of the resident, looking for, want to do the procedure, but never done the procedure, not comfortable putting an art line, but you have done so many art lines, though it's not your patient, it's okay, I'll help you to get the line for you. So it's very important, that be there all the time and try to go for the extra miles. Thank you so much, and I'm happy to take any questions.
Thank you so much for explaining everything. I really feel that was very helpful for the incoming interns, and also it was very helpful for me as well to listen to all those recommendations. Do you have any questions to Tasbir sir?
I will ask everybody as well to chip in as well. I know you guys did so much, such as Pooja is doing the residence in fellowship now in a very busy hospital. So you can share your thought, Everybody, Priyata, Salima, Utcho.
All right, then I will call Dr. Sahil Bhaiya to pitch in and give us some recommendation if you want, or just carry forward.
Thank you so much, Pooja. Thank you so much, Tasbir Bhai. Uh, Whenever Tasbir Bhai talks, I always try to listen carefully, even now, because I have been learning so much from him, even just observing how he talks, even just observing what he's discussing about. And for the incoming resident, I would say that what Tasbir Bhai has been discussed, these are like gold standard, and you can always go back and like listen the session again. So I'm not gonna take very long. I know Salima just got back from night and she's gonna talk. So just uh I'll take a couple of minutes. So I don't want to say something bad, and I have no intention to discourage you who just got matched. This has been your dream. Now you are getting into the real world, so you need to be pragmatic. I have known like personally four Bangladeshi got kicked out in past 2 years from residency. Two of them fortunately got to manage. And like got to get into another residency program to pursue, but two of them they could not. So this is very unfortunate, but why it happened, especially with Bangladeshis, I mean, yeah, definitely we have a lot of virtues. Then we are lacking in some particular stuff, including, I'll say, professionalism. What Tajibai mentioned in his slide and what he was discussing about, I'd say like try to like if you try to follow everything, then you'd be the one of the best resident, I would say. So try to listen, that try to go back and listen that again when we're done with the session today. Another fact I would like to mention that a lot of us, like, when we're trying to achieve our goal, we're very serious, very proactive, and then when the goal has been achieved, we kind of like get lost. So you need to maintain the growth mindset. This is very important. From the very first day you start your residency, you need to indulge into it. You need to get involved. This is very, very important, that for you to like be into it when you're persevering through. Another fact I would say, this is the most important fact, is constructive criticism. I believe in it, and I'm still working on it. And I always tell my mentee that this is very, very important, and we are severely, severely lacking on this. If someone talk to us or give us a feedback, we don't take it seriously sometimes, a lot of time, and even if sometimes we take it seriously, we don't work on it. So if you cannot positively take a constructive criticism, you cannot improve. So, like every single day, if you practice this growth mindset, constructive criticism, every single day you will improve little by little. And at one point, you will see that, like maybe after 6 months, 1 year, you are a totally different version of yourself. And that's how you improve during residency. It is very busy. It's going to be very busy for you. Sometimes you might feel very overwhelmed, very, like burned out, but you need to make sure that you need to make sure that you are at your right mind. You are learning academically. I'm not gonna mention about what you're gonna study, but like residency is hard work. It's physical work plus mental work. So you need to make sure that while working and learning those skills, at the same time you are also learning academically. So this is very very important. We have Chief Utsho, and we have Salima, and she's still a resident. And I will let Priyota, Pooja, and Tasifa, everyone, to talk about how people can improve academically during residency. So that's it. I was not sure that I'll be able to join this session, but I'm very glad that I'm in a conference, and I got some break, so I was able to join. I would really like to thank Tasvir Bhai for making time and joining this session and presenting this amazing slide. And I'd like to thank everybody. Pooja, Salima, Prince could not make it. Uh, Utsho, definitely really appreciated Utsho. Thank you so much, everybody.
Thank you so much, Salvia, for keeping it short and sweet. Yeah, so I will start with Saida since you are in residency. Talk a little bit about like how you survived your intern years and any tips for the upcoming interns, the things, the do's and don'ts, so that they are aware what they're stepping into and they're like ready for it.
Yeah, for sure. There are more like struggles I had. First, the culture, like whoever is coming from Bangladesh, the culture here is totally different. Like you have to speak loud, you have to speak very confidently. So the thing about me was usually I'm a soft-spoken person with low tone voice, and everybody used to tell me like don't speak so low, like don't sound like that. So yeah, it was little challenging for me to talk very loud and confidently. So the culture here, it's you have to communicate with everyone. Just whenever you see a person, you see your colleague, you see your attending, just say hi, good morning, eye to eye contact. Don't feel shy. Usually, our like culture is like being shy, polite, but here it's not like that. So try to have a smile face and talk nicely to them, and show up on time. That's very, very important. Because if you are not showing on time, they think that you are not a good resident, no matter how knowledgeable you are, no matter how much you know. But showing on time is very important. And try to attend every morning report and noon conference they usually arrange, because they also keep a track on the residents, like they're offering you the morning report and noon conference. Are you willing to join or no? I would say initially for an intern is the most challenging part is to learn the EMR setting. So EMR setting could be difficult কারণ আমরা বাংলাদেশ থেকে পেপার ওয়ার্ক করে আসি এবং এখানে এসে আমাদেরকে কম্পিউটারাইজ কাজ করতে হয় এবং different hospital has different EMR setting. Some people has Epic, some hospital has Cerna. So I would like to say for the interns, like if you have any known resident there or any senior, you can reach out. If you are if you match there, that means you can reach out to anyone. Just try to get familiar with the EMR setting before you start your residency. It doesn't take time, like it takes a week, but to grasp the like everything. But I don't think a senior will, supervise you like voluntarily for a week. So just for a few days, be with that senior or someone, and try to learn how to order, how to write the note, progress note, how to write the discharge note. They have some dot phrase, so try to know how to use those dot phrase. And that's the shortcut dot phrase for progress note, for discharge, for treatment plan, for medications, everything. And also সবচেয়ে ভালো হয় যদি চার্ট রিভিউ কেমনে করতে হয় এটা যদি আপনারা শিখতে পারেন, how to do the chart review quickly, because on the first day as an intern, most of the hospitals, I think they will give you 10 patients each, so it will be very like overwhelming for you guys. So try to know how to do the chart review first, like going for the vitals, then the labs, first see the handoff, just briefly what's they showing in the AS bar, like how the patient came here, what's the assessment plan, then directly go to the vitals, labs, and the HNP, or if the patient was admitted there, the previous note, how to do those things very quickly, and how to write those things. কেউ পেপারে লিখে আর কেউ just typing করে hand off বারে just update করে. Whatever you like, whatever you prefer, you will get eventually know what is comfortable for you. But I would say try to learn those stuff from a senior or any friends in that program before you start your residency. And আরেকটা জিনিস, like রেসিডেন্সিতে আমরা যখন ট্রেনিং শুরু করি, sometimes we don't see the patient. We directly do the chart review and we don't see the patient, and attending usually come up and we just tell the attending, sometimes we lie to them that we didn't see we saw the patient, but actually we didn't. It's a very wrong practice. Try to see the patient first, then do the chart review. Or if you are very fast enough with the chart review, try to do the chart review first, then see the patient, but never lie to an attending that you saw the patient when you didn't. Like আমি বলছি না একদমই পেশেন্ট দেখে না, বাট এমন এমন কিছু ইনসিডেন্টস আমি দেখেছি, লাইক 10টা পেশেন্টের মধ্যে 8টা পেশেন্ট সে দেখতে পেরেছে, 2টা পেশেন্ট সে টাইমের জন্য দেখতে পারে নাই, বাট বাট সে লজ্জায় বলতে পারছে না. I would say that don't lie to that attending. Just tell him frankly, like, I didn't have the time to see the patient. I will see later. And attending it at the mind corner, like they appreciate if you just tell the truth. And if you're missing some labs, just don't make it up. Just tell that, okay, I have to double check. I forgot. I missed it. I will strongly say never lie to an attending, because it looks very bad when they figure it out. And I understand sometimes you feel shy and you feel hesitant, but yeah, building that practice is good. And Tasbir sir অনেক কিছু cover করেছেন, like how to introduce yourself to the patient, the bedside manner. When we go to the patient, we should introduce ourselves first, like, hi, good morning, I'm a PGY1, or I'm an intern. First, introduce yourself, tell your name, then approach to them. It's the same thing. And I would like to say one thing more, like after the rounds with the attending, try to be efficient, putting the orders, and after the orders, you have to directly go to the discharge instead of wasting time on writing progress note, because they give you a pushback social worker to discharge the patients as early as possible. So try to finish the discharges first, then go to the progress note. And if you can finish your progress note, it takes time. But if you can finish your progress note, that's a very good sign that you are very fast in typing and signing the note. But I would appreciate if you don't copy paste your note from the previous. You can copy paste, but you need some changes, like the events you have to change, the assessment plan, whatever the changes happening, try to update that. Not directly every day you're copy pasting the same note. It looks very bad and it count as a very negative mark if you do that, like copy pasting every day the same note, because they check and the attending also check the notes. And other than that, try to be very proactive. I know sometimes it's tiring every day to have the same energy, but try while rounding, at least try to have a very energy, try to have a very energetic, face, or try to have a smiley face just while in rounding. Then when you go to your room, then you can just be your own. So yeah, that's one thing. And always ask the attending like
New York City's
any
first
questions you have. Yes. Okay, sorry. So anything, any concern, don't hesitate to ask the attending or the senior. Um, all attending, I guess, and all seniors are very approachable, so don't hesitate. And I would say, like, after finishing the 2 weeks of rotation, always ask for feedback, like how I did. Please tell me. Always approach. Even I took feedback from my senior. Maybe I was an intern. My senior was a PGY too, but they know better than me. No matter what I did in my home country, no matter they did in their home country, we should not judge like this. So try to take feedback from your senior and from your attending. They will point out some important things that you even didn't know, and try to improve and work on that for your future. And you can find always a mentor in your program that you are always feel comfortable with. Sometimes you find someone like you are interested in GI or cardio or any competitive fellowship, and you find someone like a good mentor who can guide you. Always try to talk with them, how they are doing, what research they are doing. It's hard to find, but some good people are there, always trying to help you. And yeah, try to find a mentor as well. And mental health is very important during residency. So it's not about only work. After work, you have to take care of yourself. Going to gym, hanging out with friends, family is important also. During weekends, have some plan. And yeah, it will keep you energetic. And listen to your seniors, listen to your attending, show them respect. Respect is very important. Sometimes we feel like we are very confident, and that shows as arrogancy. Please don't try to be like that. Try to be humble, respectful, and they will respect you back. Yeah, that's overall from my side. I I just tried to say in short whatever I could.
You did amazing. And thank you for covering all this part, like being humble, know your patient. And also you talked about mental health. I really liked it. Now I will shift the gear towards Priyata. These you had been a resident and now you're working as a attending, new attending. It's almost a year, right? So I want to hear your
8 months.
8 months, yeah, almost a year. So I want to hear your experience as an attending, and probably you'll be able to give the feedback more to the residents.
Sure. Hey everyone. I think Dr. Islam covered pretty much everything. Thank you so much, Dr. Islam. It was really insightful. And Salima also did a great job sharing her experiences. So I will share my experience and will share my tips on how to excel in residency, and will be very brief. So I started my internal medicine residency not that too long ago, I think in June, end of June 2022. So that time my husband finished his PhD, so he had to relocate to Hillsboro, Oregon, for his new job. So as you can see that both of us were transitioning to a new phase of our life, and it was quite challenging because relocating to a new city, doing everything all by yourself, all the registration, licensing, while you were transitioning to, a residency, that was hard. It was challenging for first couple of months. However, I really enjoyed my residency journey. I have learned a lot, and you will not gonna realize it until you finish your residency and start your attending life. Again, you will see a lot of like scary stories. You will hear a lot of scary stories, see a lot of posts in Reddit or different social media platforms that people are quitting residency. They want to change their programs after a few months of joining residency or getting terminated. Unfortunately, those never happened to me. I never had thought of like, changing my program, or despite living so far from my family member. And the same thing happened to my co-residents. And I'd like to give that credit to my residency program leadership, my PD. She has always been supportive to us, always focuses on residents' well-being and good work-life balance. I'm really grateful to my chiefs who always try to accommodate my vacation requests. And I never realized the importance of work-life balance until I started my residency. Yes, I totally understand. And I agree, residency is very challenging, particularly the PGY one. Can be stressful, can be overwhelming. However, it varies from program to program. For some programs can be worse, some programs can be better. But at the end of the day, you will learn a lot. And my program did a great job, and I would say that my transition was pretty seamless. Now that was the introduction, but the first thing that I would like to discuss here is how do you prepare yourself? Now, again, if you are done with your US clinical experiences, you should be fine. If you know how to talk to a patient, how to approach, how to discuss the treatment plan with them, or how to manage a difficult patient, believe me, you should be okay. I believe my US clinical experiences, both inpatient and outpatient settings helped me tremendously. I still remember my rotation with Dr. Islam. That was a solid one. All of my rotations really helped me because first couple of weeks to months, they will observe how you interact with your patients, how is your clinical knowledge on the bread and butter cases. So please make sure that the basic management of like COPD, CHF, pneumonia, AFib, all those like straightforward cases. Make a list of those cases that you see on your day-to-day basis in your hospital. And then you will pick up those small stuffs, not so small stuffs, things such as like how to do a medication reconciliation, admission medication reconciliation, how to do a proper discharge for the patient, do the discharge medication reconciliation, how to make a good dispo plan for a complex patient. And you will learn from your seniors, your attendings, and you will just learn by as you go by. And the other thing is like if you are discharging someone with IV antibiotics, I'm just giving you an example. What are the things that you should consider before sending that patient home? Those kind of stuffs. Again, the first few months will be challenging because this is a new country, new system, but after 6 months, you will feel more confident. You will be more flexible and you will do great. The next thing that I want to discuss is EPIC or EMR efficiency. I used EPIC in my residency program. I'm still using EPIC and I love EPIC. That's because I never used Cerner. I briefly familiarized myself with Cerner when I was doing rotations, but I feel like EPIC is more user-friendly. That's because I am using EPIC. But anyways, when I started my residency, I heard a lot of scary stories that IMGs need to stay until 7, 8 p.m. before they finish their notes. Well, everyone has different experiences, so take it with a grain of salt. I personally never stayed past 5. And that includes my first month of residency. I started my residency as inpatient resident, and even my whole team. So the way it works, I was a part of mid-neuro team, so we were dealing with a lot of like neuro patients, stroke patients, MS, all the neuro cases. We had 2 day interns, and each intern had to carry like 7 patients, and the total cap was 14. And we had one swing intern like who will gonna do admissions from 2 p.m. till midnight and the cross cover for the team. And then we had 2 seniors. One was TOC, transition of care. That means they will help you. Their transition of care means like they are new PGY2s. So they will be there for first 14 days and then you will have PGY3. They will be there for a whole month and you're attending. So even the whole team were able to finish all of our stuffs by like within like 5 or 5:30. And I believe what helped me was my typing skill. So initially, first few months, I typed a lot. My typing skill was good, and so that helped me. So if you think that your typing is good, you should that should help. If you think that your typing is not good, then you should start Dragon, using Dragon. I After a couple of months, I think I started using Dragons, and that made me very efficient. And I still remember that one of my attendings wrote in my feedback that I never saw an IMG living before 5 in their first month of residency, and that gave me a huge confidence. And I would like to give that credit to my seniors, because that matters a lot, who you are working with, especially in your first month of residency. And I was fortunate enough to work with two amazing seniors who taught us how to, be very efficient, using those smart phrases, using, the templates. Sometimes they can help, placing the orders, things like that. So that really helped me. The other thing, I think Dr. Islam also mentioned about the detail and thorough note. So that doesn't mean that writing an essay. Again, that means please make sure that you put all the pertinent information there. So for if someone is coming here for multiple myeloma, recent diagnosis, remote diagnosis, make sure that you mention briefly when it was diagnosed, any recent hemonc note, recent labs, those kind of stuff. If someone already got, someone has been here for 30 days, yes, that can happen sometimes, unfortunately. And if they already received antibiotics, make sure mention that S/P IV antibiotics. You do not need to mention like the duration, 17 days, 18 days. Just make sure if they are not receiving antibiotics, just mention that they received this antibiotics, or you can just mention from this date to that date, things like that. And again, you will learn a lot from your seniors. Seniors will help you a lot. And this was the feedback, the consistent feedback I used to get throughout my first year of residency. And even in my new job, I get feedback about my detailed notes and how much they appreciate it. The other thing that I want to mention, regarding the Epic use, I know that we never used Epic in our country, right? So in my program, and I know it's also for other programs, that they will gonna, so you will gonna get a Epic training for first 5 or 6 days, where your chiefs and they will show you the templates that you have to use for inpatient and outpatient rotations, the smart phrases, things like that. And again, when you will start your rotation, your seniors will help you using those templates, how to make smart phrases. If you're seeing a COPD patients, like these are like, the very common cases that you will see on a daily basis, COPD, pneumonia, stroke, you can make smart phrases so that you do not miss those important information. And that I always try to use smart phrases, because I know, okay, even if you see COPD patients so many times, sometimes you can miss one or two little things. So I always make sure I make that smart phrases so that I do not miss any pertinent labs that I need to order, or any treatment plan, things like that. What else? I think, the other thing is make sure that you make a good relationship with your seniors. Make sure that you the other thing is that if you want to finish your stuff on time, you need to come early. I used to come at 5, at least for first 5 to 6 months. I used to come at 5 in the morning. I used to do all the pre-charting, looking at the labs, any updated plans from the consultants, or do the pre-rounding, and then discussing with the patients, discussing the treatment plan with my seniors, and then start rounding. So that also that was also helpful for me. And also please make sure that you finish your stuffs before you leave. Do not leave before finishing your notes. Otherwise, you will be marked. Don't do that, please. And regarding the presentation technique, I would say that again, your seniors will help you. And it's very attending specific. Some attendings they prefer like very brief and concise, and some attendings like it depends on the attendings, and you will learn as you go by. In a summary, again, first 1 or 2 liners when you present the case. This patient, 65 years old male, past medical history of this or this, coming here for this, and then any overnight events that you were notified, any abnormal vitals, and then any physical exam findings, any labs, abnormal labs, and then in the assessment and plan. And then the most important thing is the dispo plan. This is something that we haven't learned in our medical school because the practice was different, right? So the dispo plan is when this patient is safe to go home. All the attendings would like to know when this patient is safe to go home. So if you are not sure, you can say, oh, I think we still need to work on his fluid status. I'm still waiting for his kidney status to improve. Those kind of steps, maybe 3 or 4. I don't think that he's ready yet. I'm still waiting for the consultations, the recommendations, things like that. And again, try to get feedback from your seniors. As I said that I work with PGY2, both PGY2 and PGY3. So I always try to get feedback from our seniors, and then attending will give you the feedback at the end of the week. Things like that. Then my next topic is research and fellowship. Again, if you're interested in CURS, GI, you need to start like competitive fellowships or HEMONC. You have to start pretty early. I was interested in GI. I mean, I'm still interested in GI. I started pretty early from day one. I started working on my CV. We had in-house GI fellowship, so I worked with the GI fellows, my seniors. I talked to my program director. I did 1 month of AWA rotation in my second year at University of Michigan. I did a lot of cross-institute collaboration with EOFM, University of Arizona. I also did collaboration like internationally. So those helped me. In my first year, I still remember that I attended 3 conferences, presented posters, and did 1 oral presentation. I always made sure that things that I presented, the posters that I presented, I made sure that I published those posters in a journal, like as a like full article. It's not only the poster. So because everyone wants to see the end product of your project. Again. If you are interested in fellowship or research, you should discuss it with your seniors, discuss with your program director, let them know that, hey, I'm interested in this and that. I wanted to do AWA if there is an option there. But the sad part was, although I had a plan to apply for fellowship, but then my priorities shifted. Because I had to prioritize my family. So I decided to do my J1 waiver first. So then I started, and I had state preferences. So I started looking for J1 waiver. I started, I think, pretty early in early second year. So if you are looking for J1 waivers, and you have state preferences, please make sure that you start early. And if you do not have state preference, I think that's fine. I think plenty of like J1 waivers available. But you need to know what you want to do. Again, first year, you still have time. Think it through, and then take decisions accordingly. And if you are done with your like step 3, that's a huge advantage, especially like, before getting involved in the getting into the research projects. if you are not, please try to make sure that you are done with your step 3 before starting your residency. Now, regarding the study materials, so I used UpToDate. Whenever I see a patient and still see a patient, I always try to look at UpToDate. Then I used MaxApp. Again, if you do well in your training, that will be a bridge. Make sure that you show some improvement in your every IT exams. And I used UWorld for last 6 months. Your program should cover it. You should have like funding, educational funding for that. And I think UWorld MaxApp is more than enough. For like passing board exam, because it's just pass and fail, and I believe board exam is much easier than our STEPS exams, and my program had like 100% board pass rate this year, so I was really happy for that. And then last but not the least, please be nice, be kind to your co-workers, be kind to your senior residents, be kind to your junior residents if you're PGY 2 or PGY 3. And med students will be working with you, and of course nurses, and that will make a huge differences. I think that's pretty much. If you have any questions, feel free to ask, and we'll be more than happy to answer those questions. Thanks.
Thank you so much, Priyatadi, for covering the aspects as a resident and also from your attending perspective. I appreciate it. Next, I will invite Ucho, since you are working as a chief resident. I want to know your feedback as well. And now you can see all your residents from the balcony. So give us some feedback for that.
Sure. Thank you, Didi. And yeah, happy Sunday, everyone. I would start by saying congratulations to all the incoming residents. We made it. So, and I see my friends here as well. So it's definitely a privilege. So before starting, I would say, I would start with the topic that we have, surviving residency. And as Tasbih sir was mentioning, that why it's not enough to only survive, because this is something we wanted to do, right? I mean, this is our passion. So when something is your passion, if you just barely surviving is not the option, because you have to be happy, and the only way you can be happy is by being systematic. So if I have to look at my journey, and if I have to share 2 cents with my residents, which I do with the incoming PGY ones as well, I would start with few points. So first thing is going to be, as a first year is going to be the most difficult year of your residency. You are expected to be miserable. You are expected to be, like you will fail, you will cry, late hours, everything will happen. You will even question your own, like, why did I come? Why did I do so many things and this and that? But trust me, at the end of the day, it's going to be okay. This too shall pass. I mean, this is a famous saying by one of the, like in a movie. So I would like to say that as well. This too shall pass, and you will do great. And once you start to see that change in yourself, you will see how satisfying it is. So if I have to start with the initial 6 months, I would say, as an intern, what you have to really focus on is being systematic. And how can you be that? One very important thing, because not everything is going to be in your hand, but one thing that you can do is being punctual. Because from the very first day, if you are punctual, it usually like takes initial 6 months to have someone's impression that, okay, this guy is punctual. So once you're punctual, you are dependable, you're automatically dependable, that I know that this resident will show up, so I can count on him. So once you have that reputation, I mean, I would say that will help you carry out through your residency. That's number one. Second thing I would say is, first few months, at least the first initial 2 months, focus on learning the logistics. You have to know how to use Epic very well, because as an intern, we have this tendency, we don't know what to start with, we don't know what to do, what to focus on, because you are still trying to do your apartment hunting, you are still trying to impress the attendings, you're trying to make your name in the program. So many things, right? So it can get very chaotic. What I would say is, if you make this agenda that for the next 2 months I'm going to learn Epic, that's it. Like, focus on all the nits and bits of Epics. Like, ask your chief residents, ask whoever is good with Epic, try to see how they do that. Because if you're good at Epic, you'll be very efficient, you'll be very effective. And like, the things that someone else will be doing in 15 minutes, maybe you will do it in 5 minutes. So that will give you that initial edge. So initial 2 months, initial 3 months, focus on learning the Epics. Another thing is, know the logistics of that hospital. Like, every hospital has their different logistics. Like, you have to know where the blood bank is. In case of any emergency, you might have to go there. You have to know how to escalate these things to the social worker. You have to know how to escalate a patient discharge. So eventually, as an intern, not initial month, but eventually, this is expected from you, that you know the logistics. So I would say that try to be very, very comfortable with the logistics, how things run in your hospital, how these lab works are done, how to escalate this, how to make sure that these things are being done for patients' care favor. So yeah, learning the logistic, that's I feel like is going to change the way you survive in residency and the way you excel in residency. Another thing is, whenever I had this with me because I didn't have that much clinical experience back home. So when I came to residency, I had this, that, oh, I have to do something to make my name, create my impression. So what I used to do is, like, there was a like, if there was a case, I used to jump to the uncommon things first, just to show that, oh, I know about these things. But I would say that's not the right approach. As time passed by, I kind of picked up that you always have to have a very systematic thought process, always common things first. And once you are very systematic and keep on doing that in mental framework, you have to build your own mental framework. Once you're very systematic, you will see how effective you're becoming over the, it's all about compounding, I would say. And we will come to that. What do I mean by compounding? So try to be systematic, first things first, and then always think about the difficult things and everything later. Another thing is, as an intern or a first year resident, this is your time where you have to be very, very proactive, because I would say this is a very protected time of the year where you are not directly answerable to things. So you are free. And by free, I mean that you can learn as many things as you can. You cannot be hesitant to ask questions. Always ask question. For example, how to do this, why are we doing this? Many of the times we just see that, okay, my senior is ordering this, okay, I will take it for granted and start doing that without asking. But we miss that learning opportunity, because first year is the, I would say, the best year to learn these things, especially the initial 6 months, because you have very low expectation. No one is expecting anything from you. We all know that you are here to learn. So use that time. Be very, very proactive and very, very humble. Always ask questions. Don't take anything for granted. In medicine, everything has to make sense. And to that, I would like to add one more point. Over the time, we have this tendency that, okay, this patient is only coming for COPD. Someone said that, and we kind of accepted it without verifying. I have seen that that's a very huge mental biasness that we have among the physicians. And I would say that actually is not a good thing to have. Always try to question that, okay, someone is saying this patient is having COPD, but is it really documented somewhere? Is it like, proven by spirometry or something like that? I'm giving an example of COPD, but try to avoid that mental mapping. Once you start to do that, you will see that you will become reliable. Your residents, your attendings, they will notice this fact, and that will help you differentiate. Another thing is, someone was also mentioning about the physical examination and that part. So as an intern, because there are different layering system, like when you are working in the floors, inpatient setting, there are different kind of layering. So there will be interns. On top of that, there will be residents, and then on top of that, there will be attendings. So as an intern, what I have seen from my experience, that the residents, what they expect from you is, your patients. So yes, intern year is very difficult. As a single person, you may be handling 10, 12, like maximum 10 patients. So it's very challenging for you. But what you have to be very honest about is the physical exam. You have to see every patient. And to that, I would like to share a trick that many of the times it's not possible that before the pre-round starting, you are able to see all the patients. So try to keep in mind that not every patient is a priority for that day. There will be many patients who are very stable enough, they're already managed, just waiting for the discharge protocols, discharge logistics to happen, and then they will be discharged. So those patients, keep them low in your priority list. But someone who is being actively admitted to the floor, someone who is, you are seeing, when you open your Epic, there is a tab where you can quickly see the vitals. You are seeing that, oh, something is not making sense, someone's saturation is low. So that patient is your priority. So have that mental mapping in your brain that, okay, this patient I'm definitely going to see. I cannot miss seeing this patient. But maybe someone who is very stable, I know about this patient is going to be discharged, just waiting for something. You can wait. Like, that patient can come down in the list. So if you keep that mindset, I think that will help you surviving the initial few months. One other thing is, it might sound little, I would say, informal, but 5 questions that I always teach my interns, and also someone like with whom I'm working in the team, that I expect my interns to know these 5 questions on all my patients. And if my interns or the team knows about these 5 questions, if we have a good answer to these 5 questions, I know that the team is safe. So the 5 questions that I asked: are my patients eating? Are my patients peeing? Are my patients pooping? Are my patients on a DVT prophylaxis? And then the fifth question is, what's making them stay in the hospital? So, I mean, if someone wants to make a note out of it, one of my mentor actually taught this to me. And I would say this has been a very good way of like systematic thinking for me. So again, I would repeat that 5 question is: my patient is eating, peeing, pooping, DVT prophylaxis, and why the patient is staying in the hospital. If you can answer all those 5 questions, you know your patients, and patients are safe for that day. Take your time, manage the complex things, and then yes, you will survive or do excellent in the day. Now coming to the feedback part, and also your about your approach and attitude. In medicine, no one can be right. Like, no one can always be right, and it's all about collective thinking. Yes, we all have our own biasness, and we try to use our logics, we try to use the patient context and everything to come to a conclusion. But always be very open that I can always be wrong, and even a medical student can teach you. I have had so many amazing cases diagnosed by medical students. So you always have to have very humble to take their feedback. Just because you're an intern, a resident, or just because you are a like you have done this and that back in your home country, doesn't mean that you know everything in medicine. So have that mindset, and it should reflect in your work. When you are talking to your attendings, you shouldn't be doing it just for the sake of surviving. You should be doing it with the whole purpose that you are here to learn, and whatever, if you learn, you can contribute, and that makes you happy. So, and that's the whole purpose, right? Because that serves your passion. So I would say again that yes, this is very important, that we have to be very, I would say, vocal, very, but very humble. We always have to be very respectful towards the patient and everyone. Another very quick thing that I would like to share is, always be very nice to the nurses, because they will change, it will change your life. I mean, a difference between an effective resident versus a first year resident who is suffering, I would say nurses, they play a very key role to it, to this. Many of the times, because they're working there for such a long time, they have a very good clinical acumen, which you might not be having. So yes, always be ready to ask them, because what the practice that I try to do is, if the nurse is at bedside, I always ask them, how do you see the patient? What's your thought? I mean, anything that overnight that you would like to mention, because they are always at bedside. So that, I would say, if we keep that feedback in our mind as well, that will definitely help us as well. Coming to fellowship thoughts, I would say that, I mean, like in first year, it's a very tricky time in a sense. We don't have that much exposure. Yes, we might have be some notion that I want to go for cardiology, I want to go for GI, but first year I've seen many people changing, like make people who were interested in GI ended up in going for rheumatology. So I would say how to kind of use that time, because I actually got this question very frequently from my interns as well. What I would say is, keep your mind open, but one strategy that you shouldn't be missing is, don't stop working on researches. Because what will happen, you want to do fellowship, you don't want to do fellowship, you want to become a hospitalist, try later, whatever you choose. If you burn your bridges now, but not by not doing researches, at the end moment you will regret, because without researches you will not feel confident to apply for the fellowship. So by that time, even if you decide that yes, I want to apply for fellowship, you cannot, because your application is not ready. So I would say no matter what you want to do, keep exploring, but continue working on researches, because that doesn't burn your bridges. And then you can always decide on, even to become a good hospitalist, to become like to go to a good hospitalist program, you need to have good researches. So that's another thing. One other thing, I encourage everyone that yes, try to apply for chief residency, because this is definitely a very humbling experience. I mean, the things that you learned from this, like this exposure, this is invaluable. I mean, you cannot compensate that for anything. And I mean, it feels good, right? I mean, the title stays with you as well. So I would say America, it's a country where you have to be really vocal about it. So like all your mentors and all your people, all the people that you count to, go to them, kind of, and express them that hey, this is what I have, like this is my intention, and I want your feedback, help me prepare, how can I become good, so that you start seeing me like in that position. So I would say that also really helps, because as Bangladeshis, we have this tendency that we try to be very quiet, we are very humble as a nation, I would say. But I would say yes, these are the moments where we have to take the ownership, and we have to show up, we have to be a little vocal. One other thing is mentorship. I cannot, I mean, like, I have always credited the few people who I consider my mentors, like whatever small things I've done in my life, it's because of those people. They were there to guide me, that you should do this, do that. So one I asked one of my mentor, that how do you know that this person is your mentor or not? So he said a very good thing to me, and he said that a mentor is not someone who can give you facts. A mentor is someone who gives you decision, who helps you take decision. So keep that in mind. Try to find a mentor, because medicine is very mentor based. If you have a good mentor, they can teach you so many amazing things that will change your life. So yes, be very, very proactive in looking for mentors, and try to have a mentor early. Another thing is regarding the mental fatigue. uh, Residency hours are difficult, especially the first year. It's very difficult, long hours and everything. But try to prioritize your mental health. You will be having so many like wellness days and different GME allocated days, like ACGME allocated days. I would encourage you to take that, because sometimes we don't know about those days, and sometimes we don't take them. But I would say take those, because in the long run, if you are a happy resident, you make the whole residency program happy. So I would say prioritize on that as well, and that's your right. That's not something that wrong. So don't feel bad or hesitant about asking for a sick day if you really need it. Don't feel bad for asking for a personal day off, which is in your from your designated quota of personal days off, because that's you need it in the three challenging years. One other I would say, this is the last thing that I would share, that few resources that I really find has been very helpful in my overall journey. And here comes the concept of compounding. So it's not about just one day I'm gonna do very excellent, and then like for the rest of the year I'm not gonna do anything. It's not about that. What I would say is, it's all about putting maybe 5-10 minutes of every day, and by the end of the year you will see how much you have accumulated. So that's the concept of compounding. Few things I would say, if you want to this time, I don't encourage anyone to study. I would say this is the only last time of your life where you can be free, no travel restriction, nothing. So spend as much time as you can with your family, because these are the memories you will always carry forward. So I strongly recommend, don't study. But if you want to dedicate like maybe half an hour every day, because I know we all are nerds, I would say focus on EKG skills. There are few very good resources in YouTube. One is Strong Medicine. I really like that. And another platform, it's called EKG Weekly. It's a paid platform, but I would say every week they post a video, like 10 minutes, 15 minutes. Just kind of watch it, and you will see how kind of how much you can accumulate over time. That's something I strongly recommend. Actually, one of the previous PHA mentors, Sosanapo, she actually shared that with me, and I still use it, that EKG platform. Uh, another last thing is few resources that I would like to mention. I listen to few podcasts because I find them very updated, and I think it's a very, like, easy to go and easy to kind of listen to, easy to understand as well. So few of them is, if someone wants to take a note, it's one is called Clinical Problem Solvers. It's available in YouTube. Another one is called Core. I will also write it in the text once I'm done. It's called Core IM podcast, and another last one is called Curbsiders. So these three I follow, and it has been very, very amazing. The PHA sessions that we host, it's also amazing, very informative, very knowledgeable, and very great platform for network building. uh, there is one other called Emory Cardiology. Whoever is interested in cardiology, they can follow that. So I would say that will be all from my side. Yeah. Again, congratulations and thank you again, PHA.
Thank you so much, Utsho, for covering all the aspects. I really enjoyed hearing those. Do you all have any questions for us that we didn't answer, or you feel like you need to know more about those? You can unmute yourself, ask the question, or you can shoot it in the chat. Okay. Yeah. So currently, as I'm working as a fellow, I will say that, yeah, definitely residency was challenging because I did my residency from Harlem Hospital. And when I was going there, everybody was like, this is very malignant program. You have to be very careful with the patient population and also the administration and the work burden, obviously. But I will say that that made me very strong. Like when I came to Houston Methodist and when I see all the resources available to me. And when I think back of my residency, that we had to sometimes draw blood, take it to the labs, even sometimes go to the blood bank to convince the blood bank that we need the blood. I think whatever you are in, I will say that enjoy those moments and remember why you came into the residency. This is what you wanted to do. I had one rotation in surgical critical care where I had to go at 4:30. So just imagine I had to do it for a month. But then back in my mind is like, this is what I wanted. And if I have the knowledge in managing the surgical critical care patient, that will be great. You all covered everything. So yes, pre-chart the patient, that will help you. And what I did in my residency, I tried to at least read one topic a day. Like if you see a patient in COPD exacerbation, like read about a article or a topic, like why the exacerbation, how to manage, all those things that will help you, that will prepare you for the residency, the board exam as well. And like Priyatadi said, if we can pass USMLE, board exam is really easy. It's just to keep yourself hands-on. And then obviously we are here to guide you anytime. If you need any help or anything, just reach out to us. Just be mindful, since we are also working, probably we might respond not in a fast manner. Probably our response can be delayed, but we'll definitely reach you back so that we can help you. And obviously, congratulations, you made this far, and we appreciate all your efforts. This is all you did it, and wish you all the best for your next step. If you don't have any question, I think we will close the session over here because we have another session that got delayed because of us. But we will stay in touch, and I appreciate all of your times. Thank you. Have a good day, everybody.